I bring this message on the eve of the Federal Reserve's decision day, whether to raise interest rates or not. It was 7 years ago that the Fed cut rates down to nearly zero to manage the wounds of our failing economy back then. The New York Times described it as nursing our ailing economy back to health. Most people have stories of loss related to the year 2008. But what will be the medical and health implications of this governmental decision if they raise rates on those living in the United States? Hi, I'm Dr. Dave Campbell. While I am not an economist, I do provide medical care to patients nearly every day and have done so since getting my medical degree in 1985. I can attest to the fact that medical care is not free. Medical care is necessary. Medical care will be harder to come by for those that need to borrow money to receive it, and medical care will be easier to obtain for those that are savers that already have money in the bank. The rising out-of-pocket costs for healthcare are seen in increasing copays and increasing deductibles across the board. Medicare, Medicaid, private health insurance, all those entities come with the increasing burden of needing to dip into savings or to borrow money to pay for care. Increasing interest rates will favor those Americans with money in the bank and will draw down on the access to care for those without readily available funds. It does not take an economist to figure that one out. Fortunately, our veterans are somewhat protected from these vagaries and decisions. The VA healthcare system, while challenged, at least is less burdened by the trend for increasing copays, deductibles, and the cost of premiums. Again, the New York Times reported that taking out an auto loan, carrying a balance on a credit card, or buying a house with a mortgage becomes more expensive. But when you are sick or injured and need a doctor, nurse practitioner, or emergency department, when your defenses are down and you feel terrible, these copays and deductibles are really painful. There will be medical and health implications from the Fed's decisions. But a stagnant economy or runaway inflation brings its own pain to each of our lives. Confidence in our government's ability to make decisions in the best interest of all of us is important. We may all complain, moan and groan about such decisions, actions, rules, and regulations that are handed to us by the U.S. government, but as an American, the alternatives are far less appealing. Thanks, Dr. Dave Campbell.